Welcome, everyone, to this amazing session today. In today's session, we have a fantastic panel of speakers who will be handling the wider topic of everyday ethics and justice considerations for health policy and systems research stakeholders. I am Dr. Kamuya. I'm based at the Kemri Wellcome Trust Research Program in Kenya. Currently, I hold a Wellcome Trust Fellowship in Humanities and Social Science, and I also head one of the 4 scientific departments in the program, the Health Systems and Research Ethics. I hold a multidisciplinary fellowship that is looking at engaging communities on complex topics, and this is especially relevant now, given the situation globally around global health research and what we are going to do. Ethics is obviously a very core element of my work. We have a fantastic panel of contributors in today's session, coming from quite wide disciplines, but tied together because they are part of health policy systems researchers, and they come with a wide knowledge. So we have Professor Shea Abebilo, and I'll be introducing to each one of them more in details as they go for each session. So we have Professor Shea Abebilo, based in University of Sydney, Professor Sasi Molyneux, who is based both in Kenya and Oxford University, Professor Hayley McGregor, who is based both in Institute of Development Studies in the UK and also conducting amazing work in South Africa. We have Dr. Manase Mishra, who is based in India, Professor Bridget Pratt, who is based in Australia, but also doing a lot of work in many diverse settings, Professor Daniel Redpath, who is based in Bangladesh, and Dr. Busisiwe Nkosi, who is based in South Africa. These are going to be part of our panelists today, and I'll just give an overview of the session and how we are going to run it. Our session is organized around looking at ethics. We aim to discuss everyday ethics in health systems, in health policy and systems research. We often think ethics as something that is discussed in books, in guidelines, when we are thinking of ethics protocol, or when we want to have a discourse around ethical issues. But we sometimes do forget how in our daily activities, in our everyday decisions we are making, how much ethics is a central part of it. And in the ethics thematic working group, we've been drawing attention to the fact that ethics is everybody's business. And in this session today, we bring in the lens of justice. Justice is becoming a very prominent topic now, especially as we are going through the current global pandemic on COVID. But also that in the literature, it's gaining traction. And it is gaining traction because it is relevant today, but it's also very much tied to the ethics decisions we make. And so our specific objectives as we go through today's session is to look at to share some of the literature, recent literature that talk about justice and everyday ethics and some of the concerns for health policy and systems researchers that is coming from that literature. And also practically really go to think of justice considerations that can be incorporated into ethics review and into our everyday ethics reflection, and actions that different stakeholders need to think of and take account of. And we'll hear how we are thinking of the different stakeholders, right from funders, researchers, people on the front line, research ethics committees, but also journal editors. And we hope through this we'll be contributing towards understanding the role of HPSR in decolonization debates from an ethics perspective, and also consider the research and the practical implications of justice in HPSR. This organized session is led by the ethics thematic working group, and we have site hosted within the HG Global. Our current goals include building awareness and interest in ethics guidance and literature that is relevant to HG members, identifying ethical dilemmas that are experienced in the course of the entire research cycle, sharing ideas and guidance on how relevant ethical theories and principles might be applied in practice, and contribute to scholarly work to the discourses on HPSR ethics, especially targeting low and middle income countries, and build capacities for ethics analysis. These are the current goals, but obviously we are reviewing these. Our current leadership includes Professor Sasi Molyneux and myself as co-chair, Bridget, who has been an amazing, wonderful, hands-on person, secretary, doing all kinds of work and making sure that as a thematic leading group, we are up and up to date. Haley McGregor, a fantastic member into the group. Freddie Kituti, who is based in Uganda, also an active member, and then Nanuka Chalangoin, who has been really supporting us with our communication. So that is who we are. In terms of how we are going to run this session, I have the introduction, and then we have a session that is looking at the HPSR justice literature, incorporating ethical principles from indigenous health research. This is work that Bridget Pratt is going to present, and it's going to be followed by a few minutes of responding to emerging questions. And then we move to the practical realities of conducting research, HPSR research, and how justice issues emerge in HPSR. And we have 4 contributors into this. We have Manasseh, who will give us a perspective from India. Sasi Molyneux and Busin Kosi will be speaking about a very specific group, the frontline research staff, and the ethical dilemmas and challenges that they face on the frontline, but also an approach to how those really key research staff can be supported. And Haley McGregor will talk about research collaborations and justice issues, how they emerge. And Sheye Abibola will be talking as an editor in BMG, as one of the editorial leading an editor in BMG Global Health Journal, but also talking about funders' responsibilities when it comes to justice issues in HPSR research. We have Professor Daniel Redpath, who will then follow up with a discussion looking at cross-emerging issues on power and positionality, and also responding to some of the questions that will be coming from the chat. And then I'll come with a wrap-up. So that is the overview of the session today. We hope within this one and slightly over an hour session, it will be not only productive, but that will engage with you interactively. And in order to do that, the platform is really amazing to allow interactions within session. You'll see that in the platform, there's a support function in case you're having problems logging in, listening. Please use the live support, which is on your top right corner, and the technical support that is being provided by Hanase. You will very quickly respond to that. We have a button for question and answer. Please do post your questions there. We'll be picking them and we'll be responding to those questions in this session. And then you've got the full screen as well. You can make your screen full instead of half screen. The sessions are recorded and they'll be available in 14 days time. And please, you can adjust your browser to whatever ratio of viewing you'd like to have. So let me take this opportunity to introduce our first speaker, Professor Bridget Pratt. She's a senior research fellow at the School of Population and Global Health in University of Melbourne. And she's a visiting professor at the Julius Center for Global Health at Utrecht University in the Netherlands. Her research interests include the ethics of global research and health systems research with a focus on social and global justice. So welcome, Professor Pratt.
Hi, everybody. I'm just going to start sharing my screen, and there we go. Okay, so today I'm going to give a fairly brief overview of what justice concerns have been raised in the literature. Before diving into what some of those are, I want to clarify exactly what my sources are. So exactly where are people voicing concerns about justice in health policy and systems research? So one place that they're doing it is within the HPSR ethics field. So there is a fair bit of HPSR ethics literature in which justice concerns are raised. And more broadly, justice concerns are also raised within the wider HPSR field. So in HPSR publications, at conferences, in blogs, on Twitter, lots of different places for dialogue around justice concerns. And then finally, there's the wider research ethics field where a lot of justice concerns have been raised, and these have been raised in relation to global health research generally, social science research generally, and they haven't at this point been linked necessarily to HPSR, but I'm sure there are a number of really relevant justice concerns that have been raised in those areas that would apply to HPSR. But that is that kind of final step of looking at those justice concerns and seeing which are relevant to HPSR is actually something that hasn't really been done too much yet. So today I'm primarily going to talk about literature from HPSR ethics and then a little bit about some of the concerns being raised in the wider HPSR literature. So in 2015, we did a scoping review of all the HPSR ethics literature worldwide that had been written up until 2015. I think it was 1990 to 2015 was the date range. And that review involved us analyzing all of the literature we found for a range of ethical issues, and justice issues were one of the range that we analyzed for. And so we found that in the literature, we identified that there were a lot of justice concerns being raised. And I'm going to take you through what some of those were. It's not an exhaustive list, but hopefully it'll give you a sense of the diversity of the justice concerns that have been brought out. So the first is around equity, and that's concern that HPSR isn't being optimally structured to reduce health disparities. So it's concerned that maybe the priorities and research questions aren't actually really aligning with those of groups and communities considered to be disadvantaged and marginalized. It's also concern, that HPSR isn't really asking the right questions. It's not asking questions about the structures that are really underlying inequities and trying to get at their root causes. It's just, asking kind of more surface level questions with technical fixes. There was also concerns raised around inclusion and concerns that the research populations in HPSR don't sufficiently include vulnerable and disadvantaged populations. And so the concern there is that health systems interventions are not really being designed with more vulnerable groups in mind. And then also that if those groups aren't part of the research population, then you're not necessarily generating any evidence that the health system interventions work for them. So you might just be showing that your intervention works for better off members of a country. There have been a number of concerns around priority setting and power and who gets to set the agenda in HPSR, and concern that it really lies with donors and researchers from high-income countries. And this is a concern that is not specific to HPSR. It's a big concern in global health research generally. Exploitation, which is also a concern that's quite prominent in global health research generally. Just concerns that, most of the burdens are borne by the study populations and community, and the benefits are really accruing to funders and researchers, particularly researchers from high-income countries. And another concern was around capacity building, and just that it's often very ad hoc and involving kind of short-term training, and it doesn't necessarily build individuals' capacity to be independent researchers. And it's also a concern that institutional capacity building is also not really focusing on getting institutions up and capable of administering their own grants and running education programs to train their own researchers and to really be able to just get their own funding and run their own studies. And when we did the scoping review, we noticed that the amount of HPSR ethics literature was increasing as time went on. So the trajectory from 1990 to 2015, we saw a sharp increase in the literature, I think from, 2010 onwards. And so there's continued to be an upward trajectory of literature on HPSR ethics. And so a lot of justice concerns have been raised since 2015. It's already 5 years ago. So I'm just going to highlight 2 additional concerns that have come out since then. And one is around research teams composition, and just the concern that research teams in HPSR may be heavily weighted, not only to high-income country researchers, but also to national researchers from the country where the research is being done, but that are really not embedded in the communities where the studies are being done. So they live quite far, probably in an urban area, and that the research teams don't actually include many locally based researchers who are embedded in the community. And it's also a concern that research teams don't include non-researchers. So they don't include, for example, in HPSR, district health teams or organizations representing disadvantaged and marginalized groups, or organizations representing patients as co-investigators. And finally, concern has been raised around funders, and just HPSR has a big emphasis on knowledge translation and also on engagement, and yet funding for those is quite limited. A lot of studies would like to be community driven, and so that means communities are involved in setting their agenda, but it's very difficult to do that when funding doesn't come until after your grant has already been awarded. So you've already kind of come up with your research agenda before you can engage communities. And moving on to the wider HPSR field, I'm going to highlight 2 issues that have come out quite prominently in the past few years. And one is around the need to decolonize HPSR. And the Africa convening was, I think, the first symposium on this topic in Africa and led by Africans. And so you can see some of their dialogue online around what's needed to decolonize HPSR. There was also quite a bit of Twitter around this topic with the hashtag decolonizeHPSR. And then another issue that came out quite prominently was around censorship. And the article, When Ethics and Politics Collide in Donor-Funded Global Health Research, was an article in The Lancet that expressed some of these concerns, that in evaluation research, donors and the entities being evaluated can often purposefully censor researchers' findings if they don't like what they've found. And that generated a lot of discussion, I think even back at the previous HSR conference in 2018. And I'm just going to wrap up by raising a few questions and saying that one finding of our scoping review was that while a lot of justice concerns were being raised, there was very little in the way of guidance on how to actually address most of them out there, and that was a big gap. And so one thing I'm proposing is that maybe a way forward for HPSR, something that can help develop that guidance, particularly given concerns around decolonization, is drawing on and applying principles from Indigenous health research ethics, because those are really focused on decolonizing the research enterprise. They have a number of principles like self-determination, which means communities have a right to determine if research is appropriate and for them, and also a right to determine whether and how they're going to benefit. Community control is another key principle, and that means that communities are given control largely through community-based participatory approaches. In some cases, this means they are given funding and they do all the research themselves. In other cases where they maybe don't have the experience to do research on their own, it's a collaborative participatory approach where they are involved in leading and making decisions around the research agenda along with funders and researchers. And then they're also contributing and overseeing all phases of the research process after that. And finally, community ownership, which is very much related to community control and means that the community owns the research process all the way through, and they also own whatever data comes out of it. And just to highlight the SAN Code of Research Ethics, which is quite interesting. They're an Indigenous peoples in South Africa who have come up with their own code of research ethics. And it has principles including respect, honesty, caring, justice, and procedural fairness. So my question that I'm throwing out is, if we want to decolonize HPSR, perhaps one way forward is maybe adapting these principles as part of the ethics guidance for the field. And I will wrap up there and hand back over to Dorcas to moderate.
Thank you very much, Bridget. We have two questions that have been raised. Kenneth is making an observation. Kenneth is making an observation that is great to see the absence of researchers who are embedded in the community and non-researchers be recognized in the literature. And it's a question that is coming out. Another comment is the value. It's actually not a question, is an observation that it sounds very valuable work with Indigenous codes of research ethics, but how can this be operationalized in terms of oversight and in committees and in terms of procedural issues? I don't know whether you have a view on how those Indigenous codes of conduct might be incorporated into the enterprise, and you know, when you think of justice lens, how that then becomes promoted.
Yeah, I mean, I think it will involve a bit of conceptual and empirical ethics research. But I think that research process in itself needs to take up the same principles. So it needs to be done not just by ethicists from high-income countries. It should include ethicists from a range of countries, including low and middle income ones. It should also involve the Indigenous people who've written the codes themselves. It's just trying to take a really inclusive approach to trying to figure out how we might apply those principles to HPSR. And of course, other HPSR stakeholders who aren't ethicists, researchers, and community engagement practitioners and others. So I see it as a lot of people coming together and doing work collaboratively. Dorcas, your sound's off.
I'll take one other question from Kenneth. He's also asking, have other non-Indigenous settings been successful in learning about the application of justice in the way HPSR is conducted, and especially drawing on the Indigenous research ethics that are said to be robust?
So is that question on whether the Indigenous research ethics principles have been applied to other research fields?
Yes, I think I would interpret to other research settings, but also, Kenneth, if, I don't know whether you'd be allowed to unmute and personally ask that question. If not, Bridget, please, you can respond based on that understanding.
Yeah, I mean, it would probably vary because some codes will be written for health research generally, but they're often written with a more biomedical focus. So it's possible some principles will be written generally enough that they could apply to HPSR. Others may be more biomedical research specific. And it will be, and there is the contextual factor that, I mean, a lot of Indigenous research ethics codes come out of countries like Australia and Canada. So there's that factor to consider, that they may be thinking more in the high income country context, whereas HPSR is often done in low and middle income countries. So a code coming from the San peoples, for example, potentially might be more applicable. I'm not sure. It's, again, ethics research that is yet to be done.
Thank you very much, Bridget. And we are now going to the next speaker, who is Dr. Manasseh Mishra. Dr. Manasseh she's a public health researcher and teacher in India, and she was the India country coordinator of the Future Health Systems. This is a DFID-funded research consortium she coordinated between 2017 and 2018. She has a broad interest in ethics, including ethical issues in health policy and systems research, disability, and social inequity. Dr. Mishra, please unmute and join. I know you do not have slides, so you'll be speaking to the panel. Yeah. Welcome, Dr. Mishra.
Thank you, Dorcas, and hi to everybody. And I shall be speaking about the specific context of a research project that we did situated in a university in India, in a poor rural community in the eastern part of the country. The project itself was part of the Future Health Systems Research Consortium, which is a global research consortium primarily of academic institutes spread across, located with partners in different continents. And the project that we did was part of the Indian chapter of the consortium, of the FHS consortium. Now, what did we do in that research project? One of the signal activities of the research project was that we rolled out a knowledge intervention. And the intervention was rolled out in a poor rural community. We, as the academic body, the research team, comprised primarily of academicians, professional academicians, typically with a PhD or budding academicians. But there were non-researchers too. We had a professional media person too on board. And this comprised the team which led the project, which conceived the project, led it, and facilitated the process in the community, the study site. It was a knowledge intervention. Our idea or our objective was to improve child health outcomes in that community in India by capacitating and empowering different stakeholders, particularly locally, those who are based locally. They may be community people, they may be local administration, they may be local organizations, people working in the local civil society bodies, a diverse set of stakeholders. And our idea was to capacitate them and empower them through participatory methods that we employed. And the objective being that at the end of it, child health outcomes, which would be better or would be in the process of being better. We engaged with a lot of stakeholders locally, typically using participatory methods. We had workshops with local media people who to report more on health status and determinants of health, to get the discourse going. We had workshops with local civil society organizations, people in the local civil society organizations, so that they could combinedly, collaboratively, we could write proposals and they could attract funding for child health in that area of India. We also had what is called the photo voice approach, where women, typically young women, mothers of young children, they were given cameras, they were taught how to use cameras to capture images from the field, which they think, in their viewpoints, they think matter to the health of the children. So these were some of the participatory methods we used in the project, in the knowledge intervention. What were the everyday ethics, issues of everyday ethics and justice that emerged? We are located in a university, and the research team primarily of professional academicians, researchers, primarily, not totally. It was definitely an example in decolonization, even though this project was part of an international research consortium. We took the call about what we thought was the issue on ground. And we designed it, we zeroed in on the issue, we designed and facilitated the implementation process. It was an example at decolonization, which is to be appreciated, recognized and appreciated. However, if we step back, if we look at the colonial project of the past few centuries and who has benefited from the colonial project, the colonial history and its legacy, across colonies of the world, there have been social groups in the colonies which have benefited from English education, which have benefited from modern education. And typically, people in universities come from these social groups. Now, the point I'm making is that decolonization is a work in progress. We, as a research team, took the call about what mattered, based on evidence, based on a participatory way of understanding issues that were foremost on the ground. But the decolonization project, it is a work in progress. So as a research team, we also carried the legacy. We inherited the legacy, the colonial legacy of being reasonably good in English, proficient in English, many people were, and having benefited from modern education. We definitely use this cultural capital to the benefit of the project. We leveraged this cultural capital, networking with stakeholders in the bureaucracy, in the civil society organizations, and helping to bring the focus to this issue, to this knowledge intervention on improving child health outcomes in that area of India. So we definitely leveraged that cultural capital. And the gains were good. We are encouraged by the results. Women who were engaged in the Photo Voice project, they, for instance, entered into dialogue with the local administration to work for solutions. The connectivity to the local health facility was improved, the road connectivity, as a result of this dialogue. There were continuous attempts to attract funding for child health in that part of the country. So the results were encouraging, but there are limitations of a time-bound research project. At one point in time, we have to withdraw. And that has implications for sustaining the gains. It also highlights how critical facilitation is to sustaining the gains. once the research team withdraws, we'll have to think about how do we keep it going. The final point I would like to make is that trajectories can be very unpredictable. This was a project that went on for close to 8 years with satisfying results. And it showed promises, there were results to show, but there were some things that were totally unanticipated. For instance, based on the FHS evidence, as well as some other research evidence, because the study site has attracted considerable amount of research attention over the years, over the decades. So based on this evidence, a case was filed with the National Human Rights Commission of India, which talked about the poor living conditions of the people. Now, this was something that was totally unanticipated. And for the local stakeholders, they were alarmed. So these are some things that comes out when we talk about everyday ethics and justice considerations. We plan for some things, we carry out some things, but the trajectories can be very unpredictable. The results can be satisfactory as we go along, but it is difficult to sustain. If we have to rethink about how do we do that. So that's about it. That's what I wanted to highlight about this project and the implications that could be drawn from it with regards to everyday ethics and justice. Over to you, Dorcas.
Thank you very much, Mishra. And please continue posting questions on the chat. For this presentation and the next ones, we'll have a discussion at the end of the presentation. So continue posting the questions. Our next speakers are going to be two. We have Dr. Busisiwe Nkosi. Busi is based in the Africa Health Research Institute in South Africa, and she's a senior social science researcher. And Sasi Molyneux, she's based both at the Kemri Campus Research Program in Kenya and is a professor in global health at the University of Oxford. They're talking about frontline workers and ethics and justice issues that they encounter. Welcome.
Thank you. So Busi is going to kick us off.
Thank you, Dorcas, and good morning, colleagues. It's still morning in South Africa. My internet is a bit unstable, so I will have to switch the video off. Thank you. So I will share some of the findings from the REACH project, which is a research collaboration with ethics integrated into a series of global health studies. The aim of the collaboration was to address researcher responsibilities in the context of vulnerability. As Dorcas has pointed out, today's focus is on the frontline staff, those of us and colleagues who actually collected the data. Next slide, please. So as noted, REACH is a collaborative study and it comprises of a network of experts from South Africa, Thailand, Kenya, and the UK. In the interest of time, I won't go through the expertise, and I hope that you can quickly scan through the slide projected. And then the aims of the REACH are to understand the dilemmas that arise post-approval in studies involving vulnerable population, and how to better support research teams in responding to these dilemmas. In each country, there are 2 case studies, and at least 3 of these include HPSR. Next slide, please. So we are going to share a video, and as that will highlight those findings and the dilemmas faced by the frontline staff. As anticipated, A key issue emerging is the importance of considering the position and support of frontline staff when conducting research involving vulnerable populations. And in this video, some of these issues are shared with the aim of highlighting the dilemmas that frontline face, the insights that we offer, and the support that's needed. And just to point out that this is a draft and it has never been seen or shown before, so feedback will be appreciated. So go to the video.
We are the frontline research staff. We are the people who gather data, take samples, speak with participants and their families, carry research messages through public engagement events. Some of us are senior in our research institution, some are not so senior. But what makes us similar is that we visit people's homes and sometimes we even land up sharing meals with them. Often, we are working in our own neighborhoods, in our own communities. We listen to people's stories and struggles with interest, concerns, and sometimes sadness, because these are stories that we know very well. We often land up being the face of research in communities and a bridge between researchers and communities. We have a lot of knowledge to share and face many challenges. Many of the challenges we face are to do with what should we do, what are our responsibilities in the community. These are really often difficult ethical or moral problems for us.
Because research happens where diseases are worst, it also often happens where there are other health, social, political, and environmental problems. There may be a drought happening at the time, water shortages, protests around a political election, or staff strikes. In Kenya, communities were facing many of these challenges during our research, including a huge national nurses strike that went on for months.
Here in Mesot, along the Thai-Myanmar border, migrants who join research on malaria and pregnancy are also sometimes living in fear of being discovered if they do not have documents. The roads and bridges may be blocked or become unavailable because of flooding, making it difficult for people to get to a research site, which is also where they come to the clinic for care.
We also see so many difficult journeys. Frontline staff also often have to cross the river in high waters during rainy season.
Despite the challenges communities face, they show strength and are resilient. It is important not to label people as vulnerable or use stereotypes because this can mask their unique needs and inadvertently exclude them from research that could benefit them. For example, labeling adolescents as vulnerable to HIV may stigmatize them and hinder participation in HIV research and result in the development of interventions that exacerbate harms in the name of protecting them. We also see examples of young people's agency. For instance, they portray themselves as proactive and being agents of change in the community whilst managing the HIV disease. So their inclusion in research is important to inform context-relevant research and interventions which support their agency.
It is incredible to see how families and women will work so hard to provide for their family and make difficult journeys to seek care and to participate in research. People sometimes think that young people or women do not have power to make choices in their lives, but they do. There was a young girl, she was 16, and she joined a study because she said she wanted to gain more knowledge, she wanted to learn more.
The biggest ethical challenges we face on the front lines are around wanting to help people directly when research results may not happen quickly and it may not bring benefits for many years. Sometimes I wonder why we're gathering data when what I want to do is provide some care or medicine to this family. I mean, something that is needed today, not tomorrow. I realize it is important to develop better health interventions that will work in our setting. But then I wish we could do more today. More support is needed in responding to ethical challenges in our day-to-day research in our context.
Here in South Africa, HIV has been a serious health burden, and so it remains a major research focus. But there are so many other health and social problems that we see people struggling with. So the question is, how can we work together with communities to make sure research priorities align with what matters most to the community? We need to identify critical points where the challenges and vulnerabilities experienced by the research participants manifest in the research encounter. This will guide and inform research institutions, researchers, and funders to reconsider the nature and scope of the duties of care needs during the research encounter.
People are struggling, but this does not mean that they do not have knowledge to share. They are experts in knowing what they need. They have ideas about what can be done in their own communities. We are excited to embed their voices in research, and they, the communities, want to be active partners in research that directly affects them. Researchers and healthcare staff working on the front line with participants and community members, they are so critical to ensure that the research helps improve the health of communities. Their role is so important to engage with communities. It benefits everyone to make sure that they're supported. We must continue to conduct research with communities for communities to make sure that they get the best evidence-based medical care. Rather than protecting communities from research, we should be protecting communities through research.
So thank you. Just a quick recap of the key messages from the research frontline staff. So we see that frontline staff of different kinds play diverse and important roles in conducting research. Sorry about that. They interact with stakeholders and participants experiencing layered vulnerabilities, as we saw in the video, and whose agency is sometimes constrained by their situation. Frontline staff face numerous ethical dilemmas post-study approval, and as colleagues will appreciate in this context, and inadequate support in dealing with these dilemmas. So well-designed research targeting and involving vulnerable populations is needed, but greater recognition of and ongoing support for frontline staff are essential justice concerns. So I will hand over to Sasi to share some more ideas. Thank you.
Thanks, Busi. I'll be very quick and just share one particular idea that we've been involving in Kenya as part of this program of work. And that's around establishing regular ethics reflection sessions to support frontline staff, including ourselves, in dealing with the very many ethics dilemmas that we encounter while we're actually conducting studies. So after they've been approved, the kinds of dilemmas we face every day. And in many ways, these are just discussions where we bring people together, but the idea is to make sure that different expertise from across the team and sometimes externally comes together. It's a judgment-free discussion where we really focus on situations where we've not been quite sure what the right thing is to do, what's the morally right thing to do. And rather than it just being a loose discussion, we've drawn on the literature and the experience and expertise of the different staff members involved to come up with a tool to help us think about each issue that we are facing in the field, and that tends, if we're not careful, to be undealt with and not raised and properly shared. So looking at the bottom right-hand area of this slide here, we've drawn especially on Richardson and Belsky's partial entrustment model to, for each issue in the blue at the bottom of this slide, think about how urgent or serious is the issue that we're thinking about. How related is it to the research? Has it been actually caused by the research? Has it been revealed by the research? Or is this a background issue that would have always been there and is encountered as part of a research activity? So I won't go through all of those elements at the bottom there, but we think about and ask open questions to really understand the issue. And then looking at the hexagons in this slide, we then try to work out what our responsibilities are and our ability to make any actions if needed. So sometimes there's nothing specific that can be done, but the issue has been raised, shared, and properly considered. Sometimes there's agreements on things that need to change in the way that we're all doing our research or supporting others in the research. And sometimes there's a need to change elements of how the study is being conducted, the design, how benefits are being given or discussed, consent processes, and so on. And sometimes we need to change what's happening in the institution around policies, and perhaps even more widely. So this approach for us, we've experienced and heard about through our team members opportunities that have come through it, including just relief of sharing some really emotionally challenging topics sometimes. Making sure, especially that in research hierarchies, where there can be quite strong power differences and there can be difficulties for frontline staff in raising issues, that these are heard by senior people and appreciated, some of these dilemmas. And it's helped to really bring to life a lot of this SOPs, or the policies and procedures that are often carefully developed but difficult to implement. But none of these meetings are and approaches are easy or straightforward. There are challenges. It takes a lot of expertise in ethics, but also a really good understanding of the institution, the context, policy, practice, and so on. Senior staff have to be interested in and keen to support the initiative and frontline staff. Some of the actions that the team themselves want to take are actually beyond the control of the team itself and need to be acted on by the institution, which is why that embeddedness in institutions is so important. And some of the issues are extremely emotional and really unsolvable, at least in the short term. And there's always a dilemma about where responsibilities end in the face of multiple structural injustices. And so just a last note to say that sessions like this, overall, we've found to be really important and helpful for the science, as well as for ourselves and for our teams to understand one another and support one another. But this can never be an intervention on its own. It must be provided in the context of good science that's relevant for local communities and the people who are involved in it. Obviously, for frontline staff, this kind of support process cannot make up for important considerations in terms of pay, career structure, other forms of recognition. And it's also really important that this is done on the top of really locally appropriate participatory training, where research team members at all levels learn from one another on research ethics in context, and also in managing and dealing with what can be extremely emotional situations faced in the field. So especially on the participatory training elements, we've been trying to work with many frontline staff in different environments to pull together resources, and these are available on this website for people who are interested. And we'd love to have more materials to share across networks through this resource. So thank you.
Thank you very much, Sasi and Busi. We are running a little bit short of time, so we are moving on to the next speaker, Professor Hayley McGregor. She's based at the University of Sussex. She's a research fellow and also a center researcher of STEPS. Welcome, Hayley.
Hey, good morning. Can you see my full screen, Dorcas?
It's not yet showing. Yes, now it's come through. I can put it in presentation mode.
There we go. Thank you. Hi, everybody. I'm going to shift the focus now onto research collaborations. So what are the practical ethical issues related to the relationship between people doing health systems and policy research and policy makers? And referring back actually to that important work done by Bridget and Hyder doing the scoping reviews on health systems and policy research, there's been, I'm sure you're all aware, a real focus on the importance of partnership as a model in that relationship between researchers and policymakers. And the objective there is to try and encourage health systems and policy research where the priority setting has been a joint endeavor, where there's been responsiveness to country priorities and country needs and the shaping of the research agenda, and consultation with key stakeholders and sort of country ownership. And there are various terms that have come up in this kind of reflection. For example, the idea of embeddedness of research, so really strong dialogue and relationship with policymakers. So I'm going to actually be referring to a paper that I wrote with my colleague, Jerry Bloom. In fact, many of us were involved in a special issue in developing world bioethics. And Jerry and I in this paper, we're taking this idea of embeddedness of research, but trying to actually think about, in particular, middle-income countries facing rapid social change, but also significant challenges of a variety of kinds within their health systems, and situations where country ownership of research is quite well established, where you have very strong local research communities and involvement of local researchers who have existing close ties with policymakers. And indeed, in these kind of contexts, in our experience, one also often gets a blurring of professional boundaries where researchers might, in fact, also have joint appointments within national or provincial decision-making bodies or departments of health. So on the one hand, you've got this sort of issue where the country ownership is well established and there are already close interconnections. But then in terms of these particular country contexts, these are facing rapid social change. The health priorities are embedded within broader national development agendas. Often policymakers are confronting quite significant health service delivery challenges, and there's really pressure to quite rapidly produce evidence to inform health systems change and to sort of scale up various interventions. And one might even find oneself as a researcher in a situation where one's evaluating an intervention which has already in some ways been pinpointed for scaling up. So you can also have these sort of timeline issues given the pressure to really produce so-called innovations to address these health systems challenges. So this is the kind of context we were wanting to reflect on in this paper, and to really ask this question: what are the implications of these two elements of such research environments for the research process, the role of researchers, and indeed the kinds of ethics reflections that might be necessary? How can researchers consider these issues of justice and equity and ownership that Bridget was laying out, but still produce knowledge relevant to policymakers in an ethical way? And can they sort of respond to the the pressure for these to address these health systems priorities and challenges, to find solutions, and yet also retain autonomy in research. And thirdly, given that kind of pressure and often the sort of political nature of some of these health issues, how can they negotiate those politics around agenda setting and national development aspirations, particularly in contexts where these professional boundaries are blurred? And in the paper, we actually looked at 2 country case studies where Jerry and I had research experience, and I originally trained as a doctor in South Africa, so I had also done research on HIV in South Africa for some time, and I in particular reflected on the very political nature right from the late 1990s of HIV research in South Africa, and how researchers often negotiate professional boundaries between research, policy making, and indeed also activism, and how in those different particular domains, the nature of problems might be framed in very different ways. And yet there's also pressure to produce solutions that particularly bring to the fore these challenges to maintain autonomy in research and to provide robust evaluations, etc., whilst remaining also aware of that need to reflect on one's positionality and remain clear of what research objectives are and what would be robust research. And Jerry, in fact, reflected on the situation of China, which is also very different politically, but there in particular, unpredictable nature of change and social change, so that the sort of scaling up of research interventions can in fact lead to unintended consequences, so that risks and benefits are an area where one needs to be carefully evaluating even as research interventions carry on, particularly when it's implementation research. So what are some of the conclusions we drew from these reflections of these 2 different country contexts and our respective research experience in South Africa and China? And in terms of the ethical conduct of health systems and policy research, we felt it was really important to try and instill within the ethics processes and a set of processes that encourage reflexivity. And you were already hearing from Sassy a similar set of reflexive processes with respect to frontline researchers. So we're in many ways thinking about whether that is necessary also in terms of these relationships and dialogues with policymakers and leaders in health. The importance of defining the kind of evidence necessary to inform decision making, and also the necessity of convening deliberative processes that allow for representative partners with a range of stakeholders. So not only senior policymakers, but policymakers at different levels, and indeed also a focus on partnership and deliberation with the communities that might in fact be at the sharp end of some of the risks of the unintended consequences of research in the context of rapid social change. And in this regard, it's really important to understand this uncertainty and the reality of potential unintended consequences, and to think of processes to address that. And in this regard, to take into account the timeframes of research. So finally, we made a really strong conclusion around reflexivity as a really important concept for health policy and systems research. So sort of drawing on this concept from anthropology and other social sciences, the importance of reflecting on positionality, what are the normative stances, and indeed recognizing the politics embedded in these agendas and thinking about how to negotiate those to retain autonomy, whilst also understanding the challenges that these policymakers are under and the need to contribute evidence for health systems change that is often occurring in a pressured environment with significant health challenges. So thinking about a process of iterative learning where one doesn't only focus on the procedural elements of ethics and sort of ethics review at the start of the project as a kind of tick box arrangement, but thinking, as Sassy was also advocating, for processes that invest more time for reflexive sessions whilst the research continues to identify quickly some of the unintended consequences of change. And then finally, just to emphasize all the points around justice, accountability that have been raised by the previous speakers, and the importance of involving a range of stakeholders, including people who are likely to be most affected by the intended and unintended consequences of change. Thank you.
Thank you very much, Hayley. Again, we are rushing a little bit with time, so I would like to introduce Professor Sheye Abebilo to take on the next session. And he's the editor of BMJ Global Health and senior lecturer at University of Sydney, a Prince Claus Chair on Justice in Global Health at Utrecht University. Welcome, Sheye.
Thank you very much, Dorcas, and thank you to the audience for joining us. So I'm going to quickly reflect on the role of two additional stakeholders in the knowledge production process, which are funders and journals. And I think their roles are very important because they play key gatekeeping role in research. And very often as researchers in health systems and other fields, we are beholden to these institutions. And for that reason, they play an important governance role in that they are governing entities. They make rules that we conduct our work by, whether by the choice of what they fund or by the choice of what they decide to prioritize in publication. But it's also important then to go to the next step and say that those rules can be just or unjust. And that it is important for us as researchers, as stakeholders in health policy and systems research, to take this seriously, that to think more clearly, perhaps, about the justice implications of the rules that these entities make. And because of that, we also need to see them as governed entities. In other words, that they're entities that deserve and need to be governed. And to think then about what the governance structures around them might look like or should look like. Because as they function currently, they seem very often quite like powers unto themselves. And as the Roman poet Juvenal once commented, that the who will watch the watchers? In other words, who will govern the governors? And for me, it's important then as researchers involved in this community to ask ourselves how might we govern these entities? And I know that I speak as a journal editor, so I'm asking to be governed in a sense. But it's important for us to think about how these entities are governed. And I identify sort of three potential levers to hold these entities to account. Sort of things that are quasi-tangible and could be identified as things to hold them to account for. So three things. First is on the question of authorship. Now, authorship has driven a lot of conversation in the last few years around partnerships in international health research, and a lot of health systems research is international in that sense. And the question is often around balance in authorship, that there's a tendency for authors, local authors, to not be represented or to not be represented in the choice positions of authorship in manuscripts. But it's important to take that conversation to the next level, which is to say, beyond just the international partnerships, what about community partnerships? What about partnerships with policymakers and other stakeholders in the health system? One of the main issues that have been raised in the conversation, in discussion in this session so far, has been the ways in which the role of people we deem non-researchers in the research process is often not acknowledged and given its due recognition. And for the question then is, at what point should community members be co-authors of a paper? At what point should people we deem non-researchers be co-authors of papers? Anyway, the point I'm trying to make here is that there are different ways of thinking about authorship and measuring what we might hold journals and funders to account for. Because what is published also is a reflection of what is funded, right? So what funders choose to fund, what journals choose to publish, is a reflection of the things we might hold them to account for. And so it's important, I think, in thinking about both decolonizing global health and also about justice in global health, to think very clearly about what it means to be an author and what it means to be balanced and fair and just in apportioning authorship, because that is one measure to which we could hold journals and funders, to say if the work you fund is not funded in such a way that XYZ people can be authors, then that is a problem. That's an example. The second tangible thing that these entities could be held to account for is the content of what they fund or publish. Again, when you read a lot of research published in a lot of the sort of elite academic publications, you will get the impression that the most important progress in health and in global health equity come about through very technological or technocratic actions. And you won't get the impression that often it's a political process, as again, previous speakers have alluded to. It's an emancipatory process, which is very, not often enough at least, reflected in what is funded and what is published. Again, that is another metric. Again, it needs to be thought about carefully, to which we could hold both journals and funders. The third metric, which is perhaps a bit more difficult to define, is the question of audience, which I've often described as the problem of the foreign gaze, which is that for whom is the knowledge produced and to whom is the knowledge produced communicated? Because when you look at the ways in which publishing works and the ways in which the research funding works, it appears really disturbingly extractive. When we say we work with communities for communities, we generate knowledge with communities for communities, the for communities part is often not reflected in how we publish, in how we think about even the end product of the work that we do. Because again, the current rules that funders often put in place and journals reinforce and universities also reinforce is that publication is the end product of the knowledge production process. Again, thinking clearly about how to turn this into something around which we could hold both journals and funders and potentially universities to account will be important. And for these three sort of measures, sort of authorship, content, and audience, I've been impressed and excited by the role that Twitter has played in the last year or two in holding journals, academic researchers, and funders to account for problematic practices, and to some extent pushing these entities as individuals and organizations to change their practices or at least shame them openly. And I think we need more such governing fora and platforms and processes and structures if we want to push and move our field towards a more just place. And again, it's been mentioned repeatedly today as well that the work of ethics committees may need to be rethought as something that is more continuous rather than a one-off for a study, so that the entire process of knowledge production becomes something subject to some kind of review process. And also the third point I'm going to make, and then I'll stop, is that the whole process of academic production or research/knowledge production could also be subject to periodic reviews in academic journals, in the public media, of performance of funders and journals and universities, perhaps along these three measures or areas of responsibility, so that perhaps we can begin to shift, or at least build that kind of governance structure and accountability system to allow health systems research move more towards a just place. Thank you very much.
Thank you, Sheye, and really very interesting discussion. Unfortunately, we are really time up. So what I'll ask is Professor Daniel Redpath, if you could just summarize. We'll not do the discussion as we initially thought, but you could just summarize and wrap it up. Thank you.
Sure, because I won't summarize and wrap it up. I'll leave it to you to close the session. It's fine. Thanks.
Thank you very much, everyone, for really fantastic contribution. There are amazing questions that have been posted. We will figure out how we can do that. But we've had really very nice experiences and literature on looking at justice and applying justice lens in everyday lives for different stakeholders. I hope you come out of here with a better understanding of the issues that are faced on the ground, but also all the way up to the funders and journal editors. So thank you so much for an amazing time. And please do get on the website. Let's continue chatting on these issues. Thank you. And fantastic panelists, thank you for your time. Thank you.
Dorcas, can I just make one last comment? It's just to say that we're really sorry to have missed a chance to hear from Daniel, and we'll do a follow-up of some of the issues raised from today, but also to incorporate some perspectives in whatever way suits for you, Daniel, to get your views and inputs in